there, and welcome to Let's Talk About Health. I'm Dr. Madeline Mant, and today we are joined by Lauren Tignanelli, who's going to tell us all about being a midwife. So welcome, Lauren. Thank you so much for joining us today.
Yeah, of course. Thanks for having me.
Absolutely. Now, Lauren, what is a midwife? What is your job? Tell me everything.
Yeah. So as a midwife, we are primary healthcare providers that specialize in low risk obstetrics. So what that kind of means is that similar to, how a cardiologist specializes in hearts or an obstetrician specializes in high risk obstetrics, we are the people that would take care of someone for their whole pregnancy. So usually we meet them at like 8 weeks prenatally.
Wow.
We see you through your whole pregnancy. We order all your tests. We order all your ultrasounds. We see people like quite a lot during their pregnancy. And then we also would do the labor and delivery. So as midwives, we can do that both at home or the hospital or a birth center, depending on what community that you're in. And then we also provide people 6 weeks of postpartum care. So during that 6 weeks, we usually for the first 2 weeks, we go and see people at home just so they don't have to leave their house with like a 2-day-old baby. But and then afterwards, they come back to the clinic. And so we're kind of like a one-stop shop for all of your pregnancy and postpartum and birth kind of needs. And yeah, because we specialize in low risk, we try to kind of normalize the whole pregnancy and birth experience for people as much as possible. And because we get to know people and we're the ones seeing them and we're the ones that are on call for their labor and delivery, it's kind of the philosophy around it is to kind of make people feel as comfortable and as supported as possible, because as you can probably imagine, being pregnant and especially delivering a baby is a very vulnerable situation. So if it's someone that you've known and who has known you through your whole pregnancy, that usually helps. But then, because we're kind of allied healthcare professionals, we work really well with like obstetricians and pediatricians and that kind of thing. So if there's ever anything that's kind of outside of our scope, then that's when we would kind of go to our high risk colleagues and go from there. Yeah.
Yeah, that's fascinating. Can you tell me a little bit more about that low risk, high risk distinction?
Yeah, so when midwifery, and it changes all the time, but when midwifery was first like legislated and registered, our college kind of wrote out, talking to midwives and obstetricians and pediatricians, what would be kind of in our scope of practice. So because most of the time pregnancy is a very normal, low risk thing, they said, okay, here are all the things that as a midwife you're able to manage. So even kind of minor complications like things like gestational diabetes or a certain range of someone's blood pressure going up or a certain thing in their history, that's still in our scope and we can manage it and we can order the tests and the follow-up that needs to be done. But sometimes there's things that are either in someone's medical history before they get pregnant, or there's something that happens when they are pregnant, like a test result that is more abnormal or more high risk. And in that sense, then in our scope of practice, it's kind of laid out that these are all the reasons why you'd have to consult with an obstetrician. And these are all the reasons why you'd have to kind of transfer the person's care to the obstetrician. Because we learn about those things, but in terms of management, or often a lot of those things, the person would need, a C-section, and as midwives, we do surgery, right? So then we kind of transfer the care over to the high risk area.
Yeah, that totally makes sense. And so a question that I've heard a lot is there a difference, or can you explain the difference between being a midwife and being a doula, for instance?
Yeah, so it definitely gets asked a lot. Like it's a very common question. And I think the reason that people get confused is because the philosophy around the two of them are quite similar, but the training and the actual work is very different. So as a midwife, like I said, you're like a registered primary healthcare provider. So and you we might talk about this a little more later, but it's like a 4-year like postgrad degree, like a residency, like all those sorts of things. Whereas a doula, it's a training program, but they are not healthcare providers. So a doula is a person who is strictly there to guide the person in making decisions and also cater to their emotional needs. So at a birth, you could have a midwife and a doula there, but the midwife would be the one like handling and managing your actual labor and delivery, delivering the baby, that kind of thing. Whereas the doula can kind of be there to, if something doesn't go the way that the person expected, the doula is there to kind of calm them down. Because although we as midwives, definitely very much a big part of how we work is we want to combine the physical and emotional needs of someone and know that that's kind of the holistic idea of health. If like someone's bleeding, I can't like go up to their head and say like, oh, how are you feeling about this, or explain as well, right? So the doula kind of takes in that emotional need, but they don't manage anything like healthcare related wise.
Gotcha. No, yeah, no, that absolutely makes sense. I'm really enjoying hearing a lot about the team aspect of this. I think that's very interesting. But you mentioned some of the training, so I really want to hear about that. So how did you get into midwifery? What was kind of the process like? And, you know, like basically, what was your journey to this as a career?
Yeah, so I think very similar to a lot of us when we're, you know, in high school or early in university, you kind of know what you like and what you're good at, and then you only know like 3 things that you could be, right? So for me, I was always really interested in like biology and health, and I loved obstetrics, so I was like, oh, I want to, you know, go to med school, be an OB/GYN, that kind of thing. Because, you know, you don't really know about the other options, which is why I think this is really cool that you're doing this. But for me, I was lucky enough that I was in my undergrad at McMaster, I did the arts and science program, which is a very random interdisciplinary program, and you can go and do a lot of things with it. So what's cool is that there's a course that you can take where alumni will come in and they'll talk about the jobs that they have and just kind of show you all the different paths that you can take. And so a midwife came to talk and talked about like her work and obstetrics and the philosophy around it and everything. And I kind of approached her afterwards and said like, oh, I want to be an OB/GYN, like this sounds kind of similar. And she's like, well, it's pretty different. So if you want, you can like shadow me for a day and kind of see. So that was really, like, for me, that was kind of the game changer of actually seeing how professions work. And so I like shadowed her for a day, got to really see that continuity piece and that relationship piece. And for me, that's always been something that's really important to me, especially in healthcare. And so when I saw the philosophy of that and kind of thought about like my personality and what I think would like suit me more, then I decided to kind of take that track instead. So for midwifery, it's like you apply, I mean, it's registered through a university as an undergrad course, like similar to med school, but you do need typically like some form of education prior, so either an undergrad or a master's or that kind of thing. So you apply through an application, and then they do that like MMI interview style as well, and then each year they take 30 people. And so, yeah, you kind of go through that process. So I went through that whole process and then luckily got in, and then it's a 4-year degree. So your first year and a half is all course-based. So definitely very still specialized courses, but a little bit more general. And then your last 2.5 years, you're still doing courses, but it's all online because simultaneously you're also doing placements.
Wow.
And practicum. So sometimes those practicums are in midwifery. Most of the time they're in midwifery and you're working with midwives or a midwifery clinic. But what's really cool in the program too, and kind of alluding to that team piece that you were talking about, in one of our years, we do only interprofessional placements. So you do a month with an obstetrician, you do a month with a lactation consultant, you do some work with postpartum nurses and labor and delivery nurses, just to kind of get an idea of what the people that you're going to be working with do and how you can best work together and that kind of thing. So yeah, that's a little bit how the training goes. And
No, that's fascinating. I love the idea of taking some classes, but also like really, I mean, literally getting your hands dirty, I'm sure rather a lot in terms of really getting in there. Like, do you want to be doing this? It's a really intimate profession. It's really, really fascinating. But you've already mentioned holism, which as an anthropologist makes my heart sing. But I want to talk a little bit more about language. And so how are you using terms like health and wellness? And are you using terms like sickness or illness or disease in your work? Like, how does this affect the work that you're doing with these women?
Yeah, I think like it's definitely an interesting question. And when I was reading, like when you had asked that, I was like, oh, that's interesting, because I think like midwifery's been around forever. Like it's like, you know, since the dawn of time or whatever. But the reason that it kind of, this resurgence happened in like the early 1990s, and that's when it became like registered or legislated and registered, is because there was kind of this need from women or pregnant folk about, you know, like pregnancy is a normal thing. So most of the time when you go to the hospital, it's because you're sick. But when you go to the hospital to have a baby, you're not sick. Like there's nothing wrong. You're just, it's a normal kind of thing. And so I think there was this really big push from women and pregnant people that like, I want this to feel normal, and I want to have that autonomy and know that like everything's okay. And so like it's kind of a like for women by women kind of profession, although there are like men and other people involved in midwifery. Like that's kind of where it came from. And so when I think about how I'm taught about health and wellness, I think, you know, we're kind of trained in the sense that like pregnancy is this normal thing. And yes, there are definitely things that can go wrong, which is why, you know, every time you see someone, you're taking their blood pressure, there's all the tests that you have to do to kind of make sure that that pregnancy is remaining normal. But most of the time it is a normal thing. And what unnormalizes it for people, or when they don't think they're well, is when they kind of get in their head about like, oh, what's going on? I'm not sure. You know, I was sent for this test, but then I never learned the results of it. And that's usually because everything's fine. But, you know, in a lot of professions, it's really difficult to keep your patient informed the whole time. But because in midwifery, we have like a lower caseload, and we have like 45-minute appointments with our patients versus like, you know, 5 when you go to see your doctor. It's really because we believe in that like informed choice and shared decision making. So when I have someone come in and it's time for their like, I don't know, like their second trimester ultrasound, instead of just saying like, I'm sending you for your ultrasound, I go through like, okay, this is what this ultrasound is. This is what we look for. Here are the risks and the, you know, advantages, disadvantages, that kind of thing. And so it's really making sure that someone feels like empowered and autonomous in their own health, which I think is definitely what people want all the time, but especially when there's like this other human that you're like responsible for, there's a lot of anxiety around that too, right? So for me, it's always really cool when I'm able to like kind of empower that person or give them that autonomy. So I think when I think of health and wellness, I just think of that as like my job kind of thing. And then sickness and illness, like that doesn't, it's more for me like the complications or the high risk kind of thing. So sickness and illness is not really terms that we use very often, or that we hear very often, or we think about very often. It's more about kind of the normal and the abnormal, like the normal and the emergency, or the normal and the complication kind of thing. So
yeah, absolutely. No, this is really, really interesting to hear a little bit of that philosophy coming through. And I'm really interested to hear even something like a 45-minute appointment. You said that, I thought, 45 minutes? I was thinking about the last time I went to the doctor, and it's no one's fault. You know, there's aspects of the system that have made it that way. But I mean, of course, we can problematize and pick apart biomedicine another time. But yeah, that's really, really interesting. I like the idea of relationship building. I think that sounds really, really important, and sounds like there's adequate and really excellent foundation of training to allow you to do so much, the medical side as well as from some of the emotional side too. But I mean, now, and I say this at the end of every one of these interviews, now I want to go be a midwife. And I'm sure everybody watching also is like, oh, this is what I've been meaning to do. So what advice would you have for somebody who's had that eureka moment and says, yes, I think I want to pursue midwifery? What would you say they need to do?
Yeah, no, it's a good question. I think, well, one, it's like, there are jobs that are jobs, and there's jobs that are like become your lifestyle, right? So midwifery is definitely like an all-in, like it's gotten a lot better in recent years, and work-life balance has come into it a little bit more as there's more midwives and more people to kind of share that load. But it's definitely like you're on call a lot, you build these really strong relationships, and it's physically, you know, being at a birth for 24-ish hours or 12 hours is physically very exhausting, but then those connections that you build, and how much, you know, that connection that you build with someone, that's also, you know, tiring as well. So it's definitely something I think that you need to really think about, like, do I really want to do this? Do I feel that kind of pull to it as well? But I think the advice that I've started to give to people a lot, whether it's about like midwifery or any kind of job that you're interested in, is for me, what was kind of the pull and the reason I decided to go with midwifery, even though I'd been thinking about other careers for so much longer in my life, is I really think you need to think about what do you like actually want to do and what suits your personality. And I talked about this like a little bit before, but for me, it was kind of like I really had to sit down with myself and like just myself, like no other distractions, and kind of say like, who am I as a person? Like, what am I good at? And also what am I bad at? And what job kind of fits that? Because I think there's a job out there for everyone, regardless of what your strengths are. And I think a lot of the times we kind of force ourselves into thinking like, oh no, I need to go and do this. And so you kind of force yourself to fit into that mold. And for me, it was more of like, okay, I know I'm really interested in health, but I'm also really interested in like building relationships, and I like having that emotional connection with people, and I like to talk. So I was like, 45-minute appointments work really well for me. But it was more about like, okay, what suits me as a person. And that was the advice that I got from, a lot of family members and friends that were like, don't worry about like what you think you should be doing. Just think about what would make you happier. And so that's kind of what I now preach to all of the people in university trying to figure out like, what am I supposed to do? So I think that's more of a general, like in general, but if it's midwifery or another healthcare profession you're interested in, definitely reach out to people and ask if you can shadow for a day, because people love to talk about what they do. Like in general, everyone kind of is like, oh, you want to know what I do? Like, cool. And so people are more than happy to talk to you about it. And for me, actually physically seeing how the job worked rather than just like reading about it or whatever was really a game changer for me. So I always think that that's a good piece of advice too. So
definitely. Yeah. Well, Lauren, thank you so much for both the personal advice. I feel sort of very inspired by it, as well as the advice specifically on midwifery, which sounds like an absolutely fascinating area to go into. And I like the discussion you said there of the lifestyle. Like this sounds like something where you do need to be all in, because if, I imagine if somebody goes into labor, it doesn't matter what's going on in your day. That's your focus. I think it's a really generous job, I think, but it sounds like a job that makes a lot of sense for somebody that I know, like you, likes to chat, but also has a big heart. So it's a really, really fascinating way of thinking about how we can integrate the personal and the professional within communities of health. So thank you so much for joining us today and sharing your experience. I know I've learned so much, and I'm sure the audience has as well, but I want to thank you and thank our audience as well for tuning in, and say that we will see you next time on Let's Talk About Health.